Welcome to the Explainer, practitioners. Look, if you're actively managing myopia, you know how crucial it is to have a streamlined process. So today, we're unpacking a really effective tool for your practice, the Myopia Care Professional Platform. We're going to explore exactly how to seamlessly integrate this system into your daily clinical workflow, literally from the second a patient walks in the door to the moment they leave. Okay, let's dive into this. We're going to follow a very logical 5-part patient journey today. We'll start with account configuration, move into adding new patients, hit recording measurement data, dive deep into clinical analysis, and wrap up with sharing reports.
All right, part 1, account configuration. Setting up your practice profile.
Now, right out of the gate, taking a minute to complete my profile is absolutely crucial because it makes your practice visible in the platform's public Find a Specialist search. But honestly, the real magic happens in the customization. By uploading your company logo, customizing the exact text for your patient reports, and curating your specific myopia treatments under the products list, you're directly tailoring the platform's entire output to your specific clinic's brand and protocol. It makes everything look incredibly polished.
Moving right along to part 2, adding new patients. Let's look at the intake methods.
The platform actually gives you 2 distinct options for getting a patient into your digital system. There's your traditional manual entry, right? That's where your staff just types into patient details and risk factors. But there's also a highly efficient public code method. Basically, if a patient completes the public myopia questionnaire beforehand, you just grab their code and the system automatically imports all their demographic data. Plus, it calculates their baseline risk factor instantly. It's a massive time saver for a busy practice for sure.
Okay, so the patient is in the system. That brings us to part 3, recording measurement data. Time for those clinical inputs.
When you're in the Patient Data tab, simply hitting Add Data pulls up a really clean, intuitive entry screen. This is where you drop in the spherical refraction values and that precise axial length for both the right and left eyes. You'll also want to check the box to indicate if the refractive measurement was done under cycloplegia, select up to 4 specific treatments you're planning to implement, and then decide if this particular axial length record should be used in the annual eye growth calculation. It's a very comprehensive yet completely streamlined data capture moment.
Now for the really fun stuff. Part 4, clinical analysis and graphs. Let's explore the 3 core tools where all that clinical data actually transforms into visual evidence.
The system arms you with 3 distinct clinical analysis tools to use with parents. First up is Myopia, which predicts prescription progression up to age 17. Second is the eye growth curve, which maps axial length strictly against age. And third, the annual eye growth curve, which is going to be your absolute primary tool for evaluating ongoing treatment success. Let's break down exactly how each of these charts works in your day-to-day practice. So the first tool, the myopia curve, is really all about visualizing the future. It takes the patient's individual risk factors, combines them with robust study data, and projects their expected myopia progression all the way up to age 17. It plots the actual measured refractive error, sure, but the game changer here is that you can overlay the projected curves of your selected therapy options. It immediately shows parents the stark, clear difference between actively treating and just ignoring the myopia. Next, we have the eye growth curve. This graph takes physical axial length and maps it directly against the patient's age. The background risk zones immediately highlight the patient's current status, plain as day. By plotting the actual measured values, you and the parents can clearly compare the child's current eye length against a virtual baseline of untreated progression starting straight from their very first measurement. It takes the somewhat abstract concept of eye elongation and makes it incredibly tangible.
Now, as the patient returns for their follow-ups, you're going to rely heavily on this third tool, the annual eye growth curve. Just to define it clearly, this is a specialized clinical graph designed to evaluate actual treatment success over time. It doesn't just look at absolute length, right? It compares the annual eye length growth since your last measurement against 2 vital benchmarks: the natural physiological growth you'd expect in an age-matched emmetropic child and the potential accelerated growth of an untreated myopic eye. And the software literally does all the heavy lifting for you here. It calculates and displays the treatment effectivity as a clear percentage. You get one metric compared to untreated myopia and another compared to that healthy physiological emmetropic growth ratio. Having these exact calculations right in front of you empowers you to confidently decide if a therapy is working beautifully or if, hey, maybe an adjustment to the treatment plan is necessary.
So you have the data, you have the analysis. Part 5 is all about sharing patient reports and empowering parents with these evidence-based findings.
The platform makes this incredibly efficient with a super fast 3-step procedure. First, you just generate the detailed myopia report right there from the analysis screen. Second, give it a quick review to ensure the custom practice text you set up way back in Step 1 looks perfect. And third, you simply choose to print a physical document or shoot it over to them digitally.
That finalized myopia report pulls in your clinic's customized text and branding, giving you a highly professional output. But perhaps the most convenient, modern feature for families today is the patient QR code. Instead of shuffling around loose papers that get lost in the car, parents can literally just scan this code while sitting right there in the exam chair. Bam! They instantly have access to their child's comprehensive, evidence-based myopia report right on their smartphones.
To synthesize everything we've covered across this entire workflow, Myopia Care truly empowers your practice. From the initial back-end setup and efficient patient intake to the precise data entry and deeply powerful clinical graphing tools, all the way through to modern patient communication, it provides literally all the tools necessary for professional, evidence-based myopia management, all in one cohesive ecosystem.
Which leaves us with just one final thought. Are you ready to seamlessly integrate this workflow and transform how you communicate myopia risks to parents today? The tools are right there at your fingertips, fully ready to elevate your practice and your patient care. Thank you so much for joining me on this explainer, and I wish you absolute success in your myopia management journey.